Hello and welcome to this show, Health and Wellness Myths and Facts. The endocrine system is a network of glands that produce and release hormones. These hormones are responsible for various functions in the body, from heartbeats to tissue growth to even the creation of new life. When people think about hormones, they probably think of the most common male and female hormones, which are testosterone and estrogen. However, children and adults produce many other kinds of hormones that affect every aspect of their health. Growth, development, moods, even character formation depends on the endocrine system. Hormones play a particularly important role in regulating growth and development, cognition, metabolism, hunger, thirst, reproduction, even the sexual function. The processes are extremely important for the normal development of children. Hormonal imbalance in children can also cause serious consequences. The burden and pattern of pediatric endocrine disorders are increasing worldwide, and symptoms of hormonal imbalance can vary widely. Each hormone is responsible for its own role. Awareness of hormonal imbalances in children is not very high, and parents perhaps don't keep track of them as much as they should, which is why this is to impart knowledge from eminent endocrinologists who are going to give us medically accurate advice on preventing various endocrine conditions in children and help viewers also identify long-term control strategies. Joining us on the program today, Dr. Ghanshyam Agarwal, consultant endocrinologist. He's joining us from Lucknow. Dr. Preeti Dabadkar, Professor, Department of Endocrinology at the Sanjay Gandhi Postgraduate Institute of Medical Sciences, Lucknow, is with us. And Dr. Soumya SL, consultant diabetologist and endocrinologist with the Apollo Sugar Clinics in Trichy, also with us. Thank you all very much indeed for being part of this conversation. Dr. Agarwal, let me begin with you. Exactly what is the endocrine system? Why is it important to keep these glands, the endocrine glands, healthy and functional? And, why must we pay special attention to this?
Yeah, good evening. Endocrine system consists of various endocrine glands and hormones they produce it. So classically, there are certain glands like pituitary gland, thyroid gland, parathyroid gland, islet cells, and adrenal glands and gonads. So these hormone produces development of secondary sexual characters, growth, and metabolic control and hemostasis. So deficiency or excessive hormone secretion causes various kinds of disease. So important diseases are short stature, like leading to short stature and reproductive system failure, and cretinism in children, then rickets and hypothyroidism and other hormone problems like amenorrhea and PCOD. So it is very important to keep our hormone system healthy so that these diseases will not occur. So for this, we have to take balanced diet, and we have to take lots of green vegetables, fruits and milk. So this is very important.
Dr. Dabadkar, who is more prone to endocrine disorders? Is it boys or girls? And, is there any kind of gender difference? And if so, why is there this sort of thing? Dr. Preeti, if you could just unmute yourself.
Prevalence of endocrine diseases are different in boys and girls, but generalization cannot be made that hormonal disorders are more common in girls or boys. The conditions which are because of autoimmunity, they are more common in girls. The reasons could be that the sex hormones, as you said, the estrogens and the testosterones, they may have an effect on the causation of the disease or the natural history or the course of the disease, and even they do impact on the response to treatment. This could be the physiological reason why diseases could be different in girls and boys. I think in our country, the socio-cultural factors are also equally important because of the bias of bringing your sons, if they are sick, to the clinic and not bringing your daughters. So maybe when you do clinic studies or you do surveys in the hospitals, you may see that boys are represented more in the disorder, which could be more to do with the socio-cultural reasons. Boys being more assertive and coming forth with their problems are likely to be reported more. And as Dr. Agrawal said, that conditions of obviously like amenorrhea, PCOD will be seen in girls only and not in boys.
Right. Let's also talk about sort of growth hormones. Dr. Soumya, when we see a short person, is that genetic? What is the role exactly of the growth hormone when it comes to height? Dr. Soumya?
Hormone is the most important hormone that is hello?
Yeah, we can hear you. Go ahead.
Yeah, growth hormone, as the name implies, that is the most important hormone that is essential for our proper growth. So this growth hormone is secreted from pituitary gland, which is a gland situated in our brain. So this growth hormone acts on the liver to produce another substance called insulin-like growth factor 1. So both this growth hormone and this insulin-like growth factor 1 acts on the growth plate, which is situated at the end of the long bone and promote the bone growth. So growth hormone promotes not only the bone growth and also the muscle growth. So the linear growth is the main function of this growth hormone. And apart from growth hormone, other hormones are also important for proper growth, like thyroid hormone, sex hormones, and also nutrition is also important apart from growth hormone, like in nutrition in childhood and adolescent days are also important for the proper growth.
Right. Dr. Agarwal, if I can just take this forward a little more, what exactly is a growth hormone deficiency and how would a parent know if their child is suffering from this kind of deficiency?
As already mentioned by Dr. Soumya, that growth hormone is produced by pituitary and causes linear growth. So whenever growth hormone is deficient, whether it is because of there is an anatomical destruction of pituitary, not development of pituitary, or there is a mutation in growth hormone producing cells. So deficiency of growth hormone produces short stature and decreased final target height, and there is a slow velocity of growth. So these three features are very important. Apart from this, there is a disproportionate body structures, and there is a small penis size, and there is a chubby cheek. So these are the features can occur. So sometimes there is a mutation in growth hormone producing cells also produces a growth hormone deficiency. So for parents, they should always keep the growth of child. If there is a deficiency, they will be short in comparison to other peers. And there is a deficiency also causes the dysmorphic features. Whenever these 2-3 things are present, they should always consult with pediatrician or endocrinologist.
Right. Dr. Preeti Dabadgao, just how is this growth hormone deficiency diagnosed? How is such a deficiency treated?
So first, as Dr. Agrawal said, growth hormone is secreted by the cells in the pituitary.
Yeah.
Before we do any test to diagnose growth hormone deficiency, we should rule out all common causes of short stature like hypothyroidism or diseases affecting your absorption, nutrition, liver, kidney. Once you're sure that none of these diseases are present, then you assess the pituitary's ability to secrete growth hormone to either a physiological stimulus like exercise or to drugs or pharmacological, as we call as a stimuli. And a random value, that means you take a growth hormone sample at any time of the day, has no meaning in diagnosis of growth hormone deficiency. The pituitary has to be stimulated to secrete growth hormone, and if it cannot be stimulated, then you diagnose growth hormone deficiency. And treatment of growth hormone deficiency is by giving growth hormone injections. And the injections are given just like as you give insulin to a patient who has diabetes. Very similar injection. It is given under the skin. Up till now, the growth hormone had to be given daily in the night because the maximum or the peak secretion of growth hormone occurs during sleep. So we try to mimic that physiology and give it at night. But now preparations are available where you can give growth hormone weekly. And results of or response to therapy is similar to daily injection as well as to the weekly injection.
Right. Dr. Soumya SL, if you could tell us a little more about puberty and what hormonal changes actually happen during puberty.
So puberty is a phase of life when a girl or a boy becomes sexually mature. So these pubertal changes starts at around 8 to 13 years of age in a girl and 9 to 14 years of age in a boy. So the initial pubertal change in a girl is usually the breast development and which is followed by the appearance of hair in the pubic area and in the armpit. So menstruation is usually the last thing. In a boy, usually the first sign of puberty is enlargement of the testes, which is followed by increase in size of the penis, appearance of hair in armpit and pubic area, facial hair appearance, and change in voice. In both sexes, there can be acne and a rapid growth spurt can be there in both sexes. And this puberty also brings about a lot of emotional changes also. So the hormonal changes that is seen in puberty, the puberty is initiated by a hormonal signal from the brain. So more specifically, a pulsatile secretion of gonadotropin releasing hormone from the hypothalamus, that is a part of our brain. So under the influence of this gonadotropin releasing hormone, the pituitary, that is another gland situated in the brain, that produce two important hormones that are LH or the luteinizing hormone or FSH and the follicle stimulating hormone. So both these hormones reaches the gonads through the bloodstream. So the gonads are ovaries in a girl and testes in a boy. So under the influence of these hormones, these gonads produce sex hormones that are estrogen in a female and testosterone in a male. So the pubertal changes are brought out by this hormone, this sex hormone.
Right. All right. Thank you all. We will take a very quick break, but there's lots more to talk about. We'll be back in just a moment. Welcome back. We're having a very serious and interesting discussion on hormones, and let's go straight across now to Dr. Agarwal. Dr. Agarwal, what is amenorrhea in teenagers and what exactly causes missed periods?
Yeah, amenorrhea is quite a common symptom we are getting in female patients, teenagers, and it is defined as an absence of menstrual cycle for one or more times in a row. So this could be primary amenorrhea or secondary amenorrhea. Primary amenorrhea is that means up to the age of 15 if there is no periods. The most common causes like there is a non-development of gonads like ovaries, or there is a defect in pituitary gland. And sometimes there is an anatomical defect in the uterus. And then secondary amenorrhea means after the menarche, means after the periods, there is a amenorrhea for 2-3 missing periods in a row. So the common causes of this secondary amenorrhea is like PCOD in teenagers, girls, then hypothyroidism, hyperprolactinemia, pituitary deficiency, and other hormones. As rightly mentioned by Dr. Soumya, there is a balance between the hormones like LH, FSH, prolactin, estrogen, and the most important, the cyclic variation is also needed. Apart from the absolute value, there is cyclic variation is also required. So whenever these problems occur, like in PCOD, there is hormone is there, but there is no cyclic variation properly. So amenorrhea can occur. So the good thing is that most of the amenorrhea most of the time is treatable. We have to diagnose and treat accordingly.
Dr. Dabat, what happens if a child starts puberty early, and just how common is this early onset puberty?
Early puberty actually can be divided into two categories, or maybe according to the age. As Dr. Soumya told you about the normal age of puberty. So if girls show any sign of puberty early on, or even boys when they show signs of puberty, say at 8-9 years of age, that is called as early normal puberty, because that is the time when the first pubertal changes are occurring. So these children usually present with some minor changes or occurrence of secondary sexual characters like breast budding or just some change. And these children eventually end up being normal in their height and usually do not have any problems later on. But if puberty occurs very early on, say in early childhood, 2 years, 4 years, then that is abnormal. That is some pathology which needs to be investigated. And that is called as precocious puberty. These children actually are tall at that time, because in puberty, you know that there's a growth spurt. So when this puberty is occurring in that age, as 2-4 years as early childhood, these children are very tall at that age, but they stop growing early on because as puberty ends, they stop growing. So eventually these children end up short. So occurrence of precocity will be associated with eventually short stature. And these children are too young to understand the changes in their physiology, in their body, which is occurring. So they have lot of psychosocial adjustments. So those problems also can occur in these children. You would see a 4-year being very aggressive, having lots of acne, having temper tantrums. So it becomes really difficult for the parents to deal with such children. And another important thing is that these children are at a high risk of sexual abuse. So any sign of puberty which is occurring early on, parents should be aware of it. They should take the patient, the child, to the pediatrician and a specialist pediatric endocrinologist to have a proper evaluation.
Right. That's a serious red flag that you bring up over there, and something for parents really to think about beyond the immediate sort of physical or medical ramifications of this. Dr. Soumya, what about delayed puberty though? What is the most common reason there? And similarly, would people with delayed puberty be taller, just as those with early onset puberty sort of in many cases tend to be shorter?
Yeah. Delayed puberty is defined as the absence of first signs of pubertal development beyond the normal range for that particular population. So in clinical practice, if there is signs of pubertal development, like if there is no breast development by the age of 13 years in a girl, and absence of that testicular enlargement by the age of 14 years in a boy, then it is considered as delayed puberty. So the most common cause of delayed puberty is constitutional delayed puberty. Actually, it is a normal variant of the normal growth and puberty. So this is due to delayed reactivation. We already discussed that hormonal changes that occurs during puberty. So these changes are delayed in these children with constitutional delayed puberty. So about the height in a child with delayed puberty, actually that depends on the cause of what is the cause for that delayed puberty. If the delayed puberty is due to constitutional delayed puberty, these children are shorter when compared to their peers during their childhood, but they catch up to others by the age of 18 years. And as adults, their height is normally in the, they will be able to maintain their height in the normal range. But in some other conditions of delayed puberty, like Klinefelter syndrome and Korman syndrome, so in these conditions, as adults, they are taller than the normal population. But if the delayed puberty is because of some conditions like Turner syndrome or hypothyroidism or multiple pituitary hormone deficiency, in this condition, the child will be, as an adult, they will be shorter when compared to the normal population. Right. So in fact, the etiology of this delayed puberty, that determines the height of the child.
Dr. Agarwal, we just heard Dr. Soumya bring up hypothyroidism, but what exactly causes hypothyroidism in children, and what is congenital hypothyroidism?
Yeah, I think this is the most common problem in boys and girls both. Hypothyroidism means less secretion of thyroid hormone, and it causes sometimes goiter. There is a mental problem, mental retardation, and there is a constipation, dryness of skin, and short stature even sometimes occur. So the hypothyroidism, the most common cause is in India is iodine deficiency, followed by autoimmune thyroiditis known as Hashimoto thyroiditis. So there is antibodies in the body that causes destruction of gland. So now coming to congenital hypothyroidism, 1 in 4,000 child born with hypothyroidism, and that is very important to diagnose because the first year is very important for the mental development. If there is a deficiency persists, so most of the child remain mentally retarded. So this is very important time. So we have to just screen this child by simple blood test during the first week of life. And the causes of this neonatal hypothyroidism is dysgenesis of thyroid glands, means not development of thyroid gland, or there is sometimes mutation in thyroid producing cells, or dysharmonogenesis, means hormone is produced but is not working properly. So this disease is definitely very common and is very important to diagnose because it causes lots of burden on society because of the mental retardation.
Right. Dr. Preeti, anything you'd like to add to that in terms of, and also maybe Tell us a little more about hyperthyroidism in children and what causes that. Dr. Preeti, if you could unmute yourself again.
Ankita, could I just add to what Dr. Agarwal said? Because congenital hypothyroidism actually is a very serious condition for the society. And all developed countries and many of the developing countries have a newborn screening program for congenital hypothyroidism. It just takes 2 drops of blood on a filter paper to have a diagnosis of congenital hypothyroidism. If you don't have those facilities, even a venous, means a blood sample taken routinely for a thyroid function test, can be done, and the family as well as the society will benefit from this. So through this platform, actually, I would encourage everyone listening to this to actually educate people to have newborn screening, which should be done after 72 hours of birth, and diagnosis should be made within the first week, and treatment should be started by 2 weeks of life. It is so very imperative to diagnose and treat so early on.
All right.
Then coming to your question of hyperthyroidism,
yes,
it is very uncommon in children. Even in our clinic, which is a tertiary level center, we see 1 in 3 months a case of hyperthyroidism in children. Mm-hmm. The common causes are Graves' disease, where you see effect of excessive hormone production in the thyroid, and then you see children who have very prominent eyes, as you see bulging eyes. That is the typical feature of Graves' thyrotoxicosis or hyperthyroidism. Then you can have because of iodine toxicity for various reasons, and others are very uncommon causes of hyperthyroidism in children.
All right. Thank you very much indeed for making that so very clear to us. Thank you all for joining us on Health and Wellness, Myths versus Facts, on this wide-ranging discussion on hormones. Thanks for watching.